Hola, Andres. Here's Laura. Okay. So, Anya, do you think, are we about all here?
Yeah, I think we could start if you like.
Okay, well, thank you, everybody. Welcome. We're here today for a seminar titled Barriers and Facilitators Affecting Teenagers' Access to Healthcare Services. Before we start, we're going to do a land acknowledgement. Anya's going to share her screen for a moment. There's supposed to be sound. Okay, I'm not sure if there's supposed to be sound with that or not. If there was, then we will make sure to have that rectified for next time. But you got the gist, and we acknowledge that the land that we are on is borrowed. Okay, so the Teenage Health Unit at the Goldman Herzl Family Practice Center joined with researchers from the Participatory Research at McGill, otherwise known as PRAM, in the Department of Family Medicine to collate the perceptions of teenagers, school guidance counselors, and staff of the Teenage Health Unit to explore what facilitated or hindered teenagers from using the services of that Teenage Health Unit at the Jewish. So joint dialogues about the findings offered a basis for developing these strategies to support greater use of services offered by the Teenage Health Unit. And I'm particularly proud to be presenting this today because this project was funded by our McGill Primary Care Practice-Based Research Network project grant. The competition that we held last year, they were the winners, and this is the product of that, so I'm very pleased. The speakers are Anne Cockcroft, MD, PhD, professor at the Department of Family Medicine, McGill, and Yvonne Quan, who's an MD, LFME, course director at the Department of Family Medicine, McGill. So let's talk first about Yvonne. Yvonne Quan, she completed her medical training and family medicine residency at McGill. She currently practices at the GMFU Herzl Family Practice Center, where she is also the medical director of the Teenage Health Unit. Dr. Quan has an interest in medical education and is the course director of the Longitudinal Family Medicine Experience, the family medicine course for the first year medical students. She's involved in resident training as the Intern Competence Committee Chair at Herzl, and she's recently teamed up with Anne Cockcroft and the Participatory Research Group to explore the factors that influence teenagers in accessing medical care. And Dr. Anne Cockcroft, she is a physician with a background in respiratory and occupational medicine. She's a professor in PRAM, the Participatory Research at McGill Group, in the McGill Department of Family Medicine. She works with CIET, C-I-E-T, which is the nonprofit group that's linked with PRAM, and where she undertakes community-based participatory research. And her recent research in northern Nigeria focuses on adolescent sexual and reproductive health and equitable community recovery after COVID-19. Current projects in Botswana involve older adults in participatory problem solving to reduce dementia, which is actually a project that she's running in Botswana, I'm running here in Montreal. So that's very interesting collaboration. And youth in co-designing of strategies to prevent personal and interpersonal violence. As part of PRAM, she has partnered with Yvonne Quan of the Teenage Health Unit at Herzl to hear the views of teenagers about what influences their use of the services offered by the Teenage Health Unit. So with that said, take it away. Thank you.
Thanks, Michelle. Let me share my screen. Well, hopefully this will work. Give me a second. Share screen. You can see my screen?
Yeah.
Okay, perfect.
Sure.
Thank you all for having us. Thank you for the introduction, Michelle. I feel like it's like the Oscars. I have to thank everybody for being here, for allowing us to share our findings with you, to PBRN for their support. So my name is Yvonne Quan. I'm a family doctor at the Jewish General Hospital, and Anne and I will be teaming together to just present our project from the last year, where we looked at barriers and facilitators that affected teenagers in accessing healthcare, specifically at our unit at the Jewish General Hospital. My slides. Okay, perfect. So we have no disclosures to share. Anne and I are the ones, I guess, we're working together on this project. But this project really wouldn't have happened without Dr. Yvonne Sarmiento and also Michaela Field, our research assistant. They did a lot of work with us along the way in planning how to do this project. And we also have a team of volunteers that went to the schools to help collect all the data. And I'm very excited to present to you the findings. And so we'll share what we came up with. Just to give you a bit of background history or where we come from. So I'm based at the family medicine practice at the Jewish General Hospital. We're a large family medicine clinic where we have a lot of different teams of physicians and residents and allied health professionals, where we manage patients of all ages for of all different sorts of conditions. And so we follow pregnancies, we follow addiction patients, and we also have the teenage health unit, where we see teenagers from all over Montreal. Teenagers come in and we see them with our family medicine residents, but also with psychology interns. And it's really more a multidisciplinary team. And we try to help them through their adolescence. And then when they transition into adulthood, they actually stay in our clinic as family medicine patients. So just to have an understanding of the role of primary care, and maybe this is up for debate in today's current politics, but just to give you an idea, primary care really is like the frontliners of following patients of all backgrounds, all ages, and we follow them longitudinally in a way to try to provide primary and secondary prevention, but also see them for acute issues and chronic issues. And it's a very multidisciplinary field. We work with a lot of different professionals to help treat our patients. As I mentioned, we see patients from all different ages, and so we do see teenagers. And I find that this to be a really critical point where we can follow a subset of population of patients, because it's such a critical time in their life. There's a lot that's going on, a lot of change, and sometimes could be quite vulnerable, or there could be something that's going on where I find we can make a huge difference in what we're able to provide them or support them as they transition into adulthood. And so thank goodness for that we have this teenage health unit, because we're actually able to uptake teenagers who don't have family doctors. And every year we are taking new teenage patients. And so last year alone, we had more than 160 teenagers join our unit, and that were followed by our residents at our practice. There are some challenges when it comes to treating teens in primary care. One of the things is that we tend to underestimate adolescent health needs, because we have this idea of they're healthy teenagers, there's nothing wrong with them medically. And so the visits might not be as in-depth or might be missing something. Sometimes it's because teenagers might be afraid to share what their health concerns are, or maybe we're just not asking the right questions. And I think this is some of the questions that we had as physicians, is that how can we try to address these concerns that they have, and how can we make sure that we're helping them with the things that concern them. So this is how this project came to be, was that we had the question of like, how can we make sure that we are providing the right services for them and that we're able to address their needs, and also to make it more accessible. One of the things I found that at our unit was that a lot of times maybe teenagers don't show up at the clinic. They'll have an appointment booked, but they don't come. And I want to know why that was the case. Was there something that we can do on our end to address that? And so I think having that question, I was introduced to Anne, and we brainstormed and came up with this project. So I'm going to pass it on to Anne now.
Okay, thanks, Yvonne. And yeah, I'm sure we'll get the slide clicking nicely coordinated. So yeah, by way of background to PRAM's collaboration with the THU on this project, it's actually a sort of a south-north experience transfer, which is quite nice. As you've heard, I've been working on a PRAM project in northern Nigeria with adolescents. And the idea is to engage the adolescents in co-designing strategies to improve their sexual and reproductive health. So I gave a brief talk about this work, and I think it was at the departmental retreat a couple of years back, and Mark Karanowski was there, and sort of first initially sort of texted me in the chat, and then we had a discussion afterwards, and he said, well, you know, maybe PRAM could collaborate with the THU, particularly using this technique of fuzzy cognitive mapping, to try to explore what would help teenagers to use the services of the THU. And then, as you've heard, Mark then coordinated for Yvonne and I to get together and brainstorm about it. So in Nigeria, we were doing this fuzzy cognitive mapping with adolescents and with parents, community leaders, and service providers. And we had adolescents between 10 and 14 and between 15 and 19. So it did include the teen age. Can I come to the next one, please, Yvonne? Yeah. So just to summarize very briefly what we did, we conducted these fuzzy cognitive mapping sessions. I'm going to say a bit more about what fuzzy cognitive mapping is. We conducted these sessions with teenagers in the schools that the THU visits as an outreach service, that Yvonne organizes these outreach visits to the schools. And so that allowed us to collaborate with the schools to be able to do some sessions of mapping with the teenagers, and with the THU staff, we did sessions, and also with the school counsellors. And then we analysed the maps and came up with some findings from the maps, which you'll hear about. And then we had some dialogues between the teenagers and the service providers and the counsellors to discuss the findings and to look at, okay, what might, based on this, what might help, what sort of priority service adaptations may be feasible. As a sidebar, we were interested from a research point of view to see what would the impact be on the teenagers making these maps. Does that have any impact on them? So we'll say a little bit about that. Can I have the next one, please? Yeah, of course, we needed to get ethics approval for this. So this was partly from the Faculty of Medicine, Health Sciences, REB, McGill. We also needed to get approval from the English Montreal School Board. And I wanted to take the opportunity now to say it was a wonderful experience, actually, interacting with the school board. They were great. They acted quickly. They invited us to. They read the papers we submitted to them. We had to submit papers, and then they invited us to come and talk to them. They had some very relevant questions, and they were excited by the idea of the project. So it was a pleasure to do business with them. So, and of course, we did the work with the ethical approval. So, as I mentioned, we had these sessions with the teenagers, with the service providers, and with the counsellors in the schools. So what is a fuzzy? Yes, that's fine. What is a fuzzy cognitive map? Well, basically, it's a diagram that you create of factors that people consider are causal in an outcome. And in this case, the outcome would be teenagers using the service of the THU. So next click, please. So, I mean, this is an example, the sort of things that people may have come up with in relation to this. I'm not going to give you the actual results. Yvonne's going to do that in a minute. But for example, they may say, well, immigrant families makes a difference whether the kids use the service or not, whether they know about the service, whether the school has links to the service, for instance, whether they're getting the outreach service, or whether how poor the families are. Next, please. And these things may then be related to the outcome. And the green arrows here are things that would have a positive impact on the outcome. So if you know about the service, you're more likely to use it. Immigrant families may be less likely to use it, but they may be interrelated as well, so that immigrant families may be less likely to know about the service. And if the school has links to the service, then you're more likely to know about it. And immigrant families may be poorer. So you can see you create this network. And the next one. So as I mentioned, these can be positive or negative influences. And then the next. The final thing we ask the people making the maps to do is to weight how strong they think that influence is on a scale between 1 and 5, 5 being the strongest and 1 being the weakest. So here, for example, knowing about the service would have been considered to be a very strong link, whereas poverty was perhaps considered to be a less strong link. So that's basically what these maps are about. Yes, please. Having created the maps, if you look at the left-hand side of the diagram here, that's what a sort of map might look like. We did these on whiteboards, magnetic whiteboards with tiles, but you can do them on a piece of paper stuck on with sticky labels and so on. And then we can digitize these maps for analysis. In this case, we created 11 maps from students. They were in groups of students. So we had 27 participants making these maps to create 11 maps. The THU staff almost all did it individually, so that we had 6 maps from 8 participants. And the school counsellors all did the exercise individually, so that there were 4 of them and they produced 4 maps. So a total of 39 participants and 21 maps that they created. I'll go to the next one. So after finishing the map, you photograph it. That's your raw data, if you like. We then digitize those, and then we put them through a mathematical model, fuzzy transitive closure, to look at the influence of the factors on the outcome, taking into account all of the other influences on the map. So in the 21 maps, we had 148 factors that were identified, and 848 relationships. So we categorize these factors into broader categories. So that gives 15 categories, much more manageable when you're trying to communicate about the findings. And the next one. Now, Yvonne, I'm giving a shout out to you. He loves this map, this diagram. The fact is, how many maps do you need to do? Well, basically, you need to do it until you're really not getting any new factors coming up. So this is the maps across the bottom, starting with the THU staff, then the students, then the counsellors. And you can see the number of new nodes or new factors diminishes. It goes up a little bit when you go to a different group because they may have a different view. But you can see that by the end of it, you've got very few new factors. So if you like, you're nearing data saturation. It means that you probably wouldn't get any more information by doing more maps. And the next.
So I'm
going to hand over.
Yeah.
I'm handing over to back to Yvonne at this point. She's going to tell you about the findings, the exciting findings from this exercise.
So as Anne mentioned, we did maps with the different groups. They were separate when they did them. And so we're going to present each of the findings for the groups. So we have for the teenagers, the school counselors, and then the THU staff. The THU staff were really the physicians that were involved, our nurse, and also coordinators who were involved with teenagers. They're the ones who received the calls from the teenagers. So for the teenage group, the question being, what were the factors that could influence them accessing our care? Their number one aspect that would promote them to come was the fact that they were aware of our services and that our outreach program was helpful in influencing them to call us. So we do high school visits as a team to different schools in Montreal, and we tell them about common issues that teenagers might come see doctors for. We try to address their questions, and it's a way to really promote the students to come see us. The second variable that teenagers identified was that they were too scared or maybe shy to go seek medical care. And this was a negative factor. And this is the second thing that would affect their chances of accessing care. The other variables that they highlighted were things that would promote them accessing our care. One is whether it was accessible or convenient to come to our clinic. Their own health awareness and education. So if they knew, for example, once I'm sexually active, I need to see a doctor for things, they're more likely to come in. And then the fifth factor they identified was the high quality of services at the THU. We didn't explore how this comes about, if it's from word of mouth or from past experience, but it's something interesting to look at. For the school counselors, it was a little bit different. The first thing they mentioned was that they felt that having a supportive school environment was most likely to influence the students to access our care. A lot of our referrals are from schools where we visit, and the guidance counselors are aware of our services, and they probably introduce the students to our clinic. So they feel like this was the number one variable. The second was good communication between patients and physicians. So if they felt like they can trust us or have a good relationship with us, that they're more likely to come. Third was our outreach and the advertising of our services. Fourth, they felt that it was, if there was a barrier to accessing services, that they will discourage them from coming in. And then the fifth variable, again, goes back to if there's high quality services at the THU, that they're more likely to come see us. For the THU staff, we identified that the most likely variable to influence them was our outreach program and advertising services. The second being the accessibility and convenience. There's different reasons to that. Sometimes we feel like the location makes a difference, or our hours might make a difference. Third, we feel that teenagers might be scared or shy to come see us, and that's probably what's holding them back. Fourth, we felt that good communication between the patients and the physicians probably makes a difference. And the fifth one, a little bit different from everyone else, we felt that parental involvement and support might make a difference. Again, I think it'd be interesting to look into why everyone thought these variables were more important. From the THU staff standpoint, I can say that a lot of times we see patients maybe coming in with their parents. And so we feel that if the parents are involved, they might be more likely to come in and see us. So then, taking all this data, we put it into a table to just really rank the different factors that the different groups isolate into what will be a barrier or a facilitator for them to come in. This is probably my most favorite slide because it summarizes all of our findings, and it shows us how each group thinks, each group thinks differently. And so the students and the THU staff, the top three variables that they identify are similar. And so we feel like the fact that the students are scared to come in or shy to come in is a huge inhibitor, and that the fact that they are aware of our services and that it's accessible is more likely to encourage them to come in. This is very different from what the guidance counselors feel, because the guidance counselors are seeing them from the ground, and they feel that their school environment and the relationship that they have with their students is more likely to promote the students from coming in. And they also feel that, the relationships between the patients and the physicians might be an important factor, but the students actually cared less so. And so this is very interesting, because how we decide to provide our service, how we decide to have protocols, procedures, it's really based on usually from the medical team. And we will survey, okay, how should we do this? How should the students make appointments? But it actually is important to include the voices of the students, because what is the first thing that stops them from picking up the phone and calling us? Their reasoning might be different from what we think. And so this is a very interesting project to be able to explore what the students were thinking. I was a little bit relieved at the end that maybe we're on the same page as the students, but it did highlight where maybe we need to put our efforts in to make sure that we are able to encourage students to come into our clinic. We also evaluate the impact, and I'll pass this on to Anne, the impact of what the project, how the participation in the study helped on the students. So Anne, I'll pass it to you.
Yeah, thanks, Yvonne. This is that sidebar I mentioned. What was the impact on the participants themselves of making these maps, which are a kind of participatory visual method, really, because you get a very visual impression of what your ideas are. So the first thing is, if I could have the next slide. Yeah, we asked them a very general question. What did you enjoy about creating your map? We were able to express ourselves and have a good time, to be listened to without judgment. And also to hear the views of other people, and to the importance of seeing both sides, quite useful. And yeah, coming up with ideas that we created, and we had a wonderful conversation. So this idea of being listened to and your ideas counting was important. And we often find this in people who partake in these things. But we're quite interested in PRAM in looking at this in a bit more detail. What actually is the impact of participation, engagement, and in this case, creating fuzzy cognitive maps on the participants in a more structured way. So we did questionnaires, online questionnaires with the students. They've answered the questionnaire just before creating their maps, and then they did it again after they created their maps. I'm not sure if it was before or after they had the pizza, was it, Yvonne? Can you remember? They had some pizza as well, but I don't think that's a confounding factor. But they made their maps, and they did their. The point is they did the questionnaire immediately before and immediately after, and we were able to match them to themselves. So we could do a before and after comparison on individuals. So can we go to the next? Oh, here we are. Yvonne has just told us that they eat the pizza while completing the tests. There you go. So that we had three things that we looked at. One was a sort of a scale in their confidence about communication, and it had a score between 6 and 30, and the elements of the scale. The 6 elements of the scale are here, and you can read them. I won't read them out. They were to do with confidence in being able to communicate with different groups of people, particularly people who are more senior to them. So what we found with that was that, yes, it looked not very exciting, the increase, but it's a significant increase in the mean scale value. And you can see there were a lot more people that increased their score than there were people who decreased their score before and after. So there was a significant improvement in that scale. We also then had another 6-point scale, which was a general self-efficacy scale. This is not a scale we created. It's an available scale, widely used. And again, it's to do with your own feelings of efficacy. And we had postulated that doing these mapping sessions may increase people's feelings of self-efficacy. So again, we had an increase in the mean scale value, and very many more people who had increases in their scale score before compared with after, and very few who had a reduction. And it was a significant increase in their self-efficacy. If we go to the next one, we also did the well-known Rosenberg self-esteem scale, this 10-point scale, which I think many people would be familiar with. It's been around for yonks, but people still use it. And it has a score of between 0 and 30 for your self-esteem. I won't read them out. Again, a positive increase in the self-esteem scale comparing before and after the FCM session in individuals. Now, I should say that there are limitations to this. It was a small number of people, and they did the post questionnaire immediately afterwards. We don't know what they would have felt like tomorrow or in a week's time, but we do know that there was an immediate change. So it's interesting and useful, and it contributes towards knowledge on this topic, which is sadly lacking, actually. So we were delighted to see this, and it reflected the sort of things that they had said as well. So I'll pass you back to Yvonne, who's going to talk about the next step once we had the findings from the fuzzy cognitive mapping.
So after we had done the mapping, Anne's group had collected all the data, and they put together the same slides that we had shown you earlier on, but into a presentation where they had deliberative dialogues. They went back to the same schools. We collected the students, and we also had the THU at these meetings as well. And Michaela presented the findings to the students, and then we had a few questions for the group, the students and the THU, to try to reflect on the findings. And so the questions we had asked is, what did you think about these results? Why do we think there was differences between the groups? And then what would you suggest as useful actions based on these results and own ideas? This was, it was a very nice it was very nice to get together. I was at those meetings with the students, and really they have things they want to say. And so it's like the teens do have a voice. And I feel like sometimes we're missing out on what they think about what's going on and how we do things. And so it's very interesting to hear from them. Some of the proposals that came out from that talk, and so this is just some of them, but they said, for example, it'd be nice to have a pop-up clinic. I think the idea of like a lot of the suggestions that came up was they wanted things a little bit closer to their own home court territory where they feel more comfortable. And so they suggested maybe having a pop-up clinic in the school, or having a representative of the THU at the school once a week. Again, I think to have that familiar face and knowing who it is. They wanted to be able to develop connections between THU with the teens to try to foster trust between the medical team and them. There was some comments about maybe tailoring our outreach to the schools. Our current outreach is a standard presentation that we give, and we talk about mental health, sexual health, and also substance use at the schools. But again, every school is different, and the interests of the teens might be different. And so they're saying maybe you can try to focus on what matters to us. Sometimes the students want to have a way to be able to contact the THU anonymously. And again, this goes back to how I say we have protocols that were designed by the medical providers. Right now, how it is that if a teenager wants to come to our clinic, they're given our phone number. They have to call our coordinator, and they book an appointment with the medical resident. But sometimes that is already a step for the teenagers. They may be too shy to make that phone call and say, hey, I have this issue and I'd like to see somebody. It came up in the discussion that the teenagers felt that if we could try to change societal and cultural stigma against mental health, it might help them in seeking care, because there is that fear of reaching out because there's maybe something wrong with me, or because they felt embarrassed or too shy to discuss their mental health issues. And so the students felt that if we can do something about the stigma, that might help encourage them to seek medical care when they have any concerns. So we brought these points back to the THU as a team, and we try to reflect, okay, well, of these proposals, is there anything that we can do? Some of it logistically we can't, in terms of like manpower and resources, but we did understand where some of these points were coming from. And so one of them was about our approachability. There is that them versus us kind of feeling, and we wanted a way that we can try to make it that we're more human, accessible, that, hey, don't be shy to come see us. One of the things that we came up with is that we do have a THU website, but maybe we could start now posting pictures of the staff that are there with personal blurbs that are not dry, but just shows the human side of us, and that we can provide this information when we go on our high school visits and say, hey, if you guys are interested, here's our website, take a look at the people there, and just so that they can stalk us and find out a little bit more about us before they come in. We thought that maybe also would be a good idea to be able to provide resources on our website, that way just for people to be able to read up about issues before they come in, just so that they feel more comfortable to come in to see us. It has come up from the mapping from both the students and also THU, and that we recognize that the outreach program is a big reason why students come and see us. We want other schools or other students who maybe don't attend our outreach visits, because again, when we go to the schools, we only see 1 or 2 classes at a time, and we are not actually seeing the whole school. We want to be able to provide information about our unit. And so again, maybe having like a QR code to our website that we can post in front of the guidance counselor office or by the locker room at schools, so that students, if they have like hey, you have any concerns, you want to ask a doctor, QR code to our website, find out information about how to reach us, and also learn about the resources that we can provide. And again, to familiarize with them, we cannot be at the schools every single week. They have nurses and social workers are there that come on periodically, but we can't visit them all the time. But maybe really when we go to our outreach visits, be like, hey, I'm Dr. Quan, I'm at the THU. This is one of the people you might come see if you come to our clinic. There were a lot of interesting questions that came out of the findings from this mapping. I think a lot of things we are making assumptions or guesses as to why people gave the reasons that they gave, but there's a lot of things that we want to look into further. And so we are, Anne and I, hoping to keep this going for many more years. have a lot of questions and want to address things. And so one of the things we want to look at is how can we tailor our visits when we go to the schools. And we know this anecdotally when we visit the schools. There's just some schools that are more interested in certain topics, and other schools, they are just tuning out when we're talking about certain things. And so we're trying to think of a way that we can maybe try to tailor our visits more from school to school. And I'd love to work with Anne about this so that we can make it more fruitful when we're going in on our outreach program. So that is just to summarize everything that we've done in the last year. We really have to say thanks to the PBRN for their support. We did get a grant from this, and that helped with our research assistant. The THU, I've harassed many of my colleagues to be able to participate in this. I do think they have a lot to say, but more importantly, the English School Board has really been supportive in this. They approved our project, and we were able to contact schools in the English School Board and have their students involved in this mapping. And so we're really hoping to continue our ties with them to further this project. And if there's any questions, we will take it from the group. Thank you. I'll stop sharing screen actually.
That was a great presentation. Good job, Anne and Yvonne and team. That was really wonderful, really interesting, fascinating to hear about what teenagers think and what their barriers can be to accessing care. Dr. Dove has a question, please.
Yeah, thank you, Yvonne and Anne, for that very interesting presentation. So a long time ago, when I was a young doctor, I worked at the adolescent clinic at the Montreal Children's Hospital, and many of the issues that you found, I resonate with what I remember from working there. And I also, 30 years ago, went on those school visits and answered the teenagers' questions, and that's also such a wonderful outreach program. In the 90s, HIV was still kind of new, so a lot of their questions were about like HIV in saliva. There was a lot of like saliva questions and HIV, and it was kind of gross. I guess my question is, the one suggestion that one of the suggestions that the teenagers had was about the pop-up unit. And I think this kind of resonates a lot with what I remember from adolescents in the Montreal Children's Hospital, was that they kind of, when they want a service, they want it immediately, because that's when they want to talk to somebody about their sexual health or their contraceptive concerns or whatever. And so I guess what kind of strikes me is that there are nurses, there are counselors in these schools that are kind of there more rapidly or easily available to these teenagers. So what is the link that you had? Like, you talked about the counselors, like, does it go kind of both ways, that the counselors can reach out to you, or do you give advice through the counselors? So that was a question.
And I'm going to take the question, okay? I have so much to say about this, and I think this is what's so interesting, is that we design things thinking this is what students need. And so CERS, like the regional health group, will decide, okay, we're going to put in a nurse, a school nurse who goes in like once a week, and then they'll be able to address their sexual health. They can do STI screening, they can do contraception, but then the students don't go. And this is what the question is, like, why aren't you going? And then sometimes we go to the school, and I will ask them, I'll say, what services do you have at your school? Half of them will be like, we have a social worker, and someone else will be like, we have a social worker. They don't know the resources that they have. And then they'll sometimes say, like, we have a school nurse, and someone will say, yeah, but don't go to her. She doesn't know what she's doing. And so there's a lot of different obstacles there that we're just not aware of, to like why they're not reaching out. So that's one thing. And I think that's why it's so important to be able to talk to them and figure out what were the barriers, because we need to adapt to that. We can't create, you know, a network for them, and then they're too afraid to seek care, because then we're not going anywhere. Just to address about the guidance counselors, so a lot of times we are invited to the schools by the guidance counselors, so they're aware of our services. And then a lot of times when students come and see them, the guidance counselor will tell them, hey, you know, there's this clinic in the Jewish General, I can refer you there. And so sometimes even the guidance counselors, with the permission from the student, will call into our clinic for them and then book an appointment for them. And they'll say, I have this student, they've consented to it, this is their phone number. These were the issues that they shared with me. And so it takes away one step from like the students having to call in, because I do think that is a hurdle. And we've tried to address how can they contact us, but realistically, they can't text us to book an appointment. We don't have means of doing that. So it's still old-fashioned phone call. But I hope that answers everything, Marianne.
Oh,
Michelle?
Laura, do you want to go first or?
Sure, yeah. Yeah, so thanks so much. It was I've loved watching the progress of this project and how you carried it out, and and so seeing the results is really interesting and inspiring. Like so as a clinician at Park X, we've been wanting to reach the adolescents better for a long time because they're not coming in like at most clinics. And so this main finding you have of like these outreach programs being so essential, which I guess was already a felt benefit, just is I'll definitely bring it back to our group again to rediscuss doing these out. And creating like yeah, like the other aspects are also sort of known barriers too, but it's nice seeing what's most important to the teenagers, and also trying to create maybe a targeted outreach presentation, somehow tailoring it to the needs of the school is also a really interesting idea. So I look forward to your future findings.
I think this also goes back to one of the points the students had brought up in their mapping, was that their own health awareness was a contributing factor. And so when we go in there, we are also educating them about things. And so they will realize that when they encounter difficulties or if they have questions, they're like, oh no, the doctor had said I can call them for this issue. And they know that there's that they know the pathway of where to go if they have any questions. And so I'd like to think that our outreach program is also helping educate them about their health.
I had a question. Did the issue of confidentiality in terms of parents finding out about reasons they're visiting the doctor, did that come up at all?
So confidential, you mean about the results of the project?
No.
On the maps.
Mm,
Do you mean on the maps?
yes.
It did come up, but it wasn't a big. It was mentioned, but it wasn't one of the key things. It was there. I remember some maps that they had that confidentiality issues and concerns about confidentiality, but actually, it didn't feature strongly. And I
Thanks.
think one of the things that was really important, actually, and Yvonne mentioned it, was that the strong congruence between what the THU staff felt about the causes and what the students thought. And that was really encouraging, actually. And also, when you start to have a dialogue between groups, it's very different starting from something where you've got this information there. This is what we thought, this is what you thought. It's not like starting from a blank page where you might, people may not say anything, or they may feel confrontational. It really helps to those dialogues to have this information to hand. And I think, I don't know if Yvonne would agree with that, but I think that made a big difference to those dialogue groups, that they started from looking at, this is what you said.
Okay, are there any other questions? Any last words, Anne or Yvonne?
I'd like to say I hope we do continue this this work together. We're looking for funding, and we've already tried to touch Michelle. Yeah, I mean, some of it doesn't cost that much, but there is a cost entailed. But as it would be so nice to be able to take this forward, because there is, it's thrown up some answers, but it's also thrown up some really interesting future directions for things that we should look at. And I know that there are some other clinics that have already expressed an interest in doing something similar. So that's another thing that's a potential future activity.
If funds become available, we will definitely be in touch. Marion?
I just want to echo everybody's encouragement. I mean, I think this is such a wonderful project when we hear about the effects that it had on the teenagers too, like just doing that participatory process. That's amazing. And I mean, in all kinds of research, everybody's always talking about, patient partners, and participatory research is really goes even beyond that. They're not partners, they're like essential. So I don't know, I would just totally echo the encouragement to continue this project. And if it's interesting to other sites, that's even more encouraging.
I wanted to add, like, I really enjoy doing this project. I find for me, because we're the ones that are seeing the patients, and like in the end, I really do think that there's a big difference that we can make in helping teens in sometimes a very vulnerable period. But I've always said, I can't help you if you don't come in. And so this is really something where I was able to identify certain things that how can I really try to convince them to like make the phone call or get into our clinic to see somebody. And so if I can hear from them what it was, then at least I can work on that on my end to facilitate it. Because again, like this is at such an important period of time. Like you can make a change for the next 50 years if you can get them in.
We can't help you if you don't come in should be the tagline of your website, honestly.
It might have to be.
Great work. Thanks so much.
Thank you.
Great work, guys. Excellent. Looking for it. What are your plans, immediate plans? So this is being presented at Family Medicine Forum this fall. I'm going to be acting as surrogate for Anne and Yvonne. But beyond that, what are your plans?
Anne, are we allowed to talk about what we've been discussing?
Well, we alluded to it, didn't we, about trying to find out what students in a particular school would be interested in the outreach for them. And so we have talked about that, and we even talked a little bit about the logistics of how it might be possible and so on. We wouldn't need a lot of funding, but if anybody's got a few quid in the back pocket, think of us, and it's it's going to be high returns for minimal investment. Look at it that way.
I'm hoping that you're also going to prepare a manuscript for submission to Adults of Family Medicine or something similar.
That is in process, actually.
Excellent.
Michaela isn't here. Where is Michaela? She's maybe she knew we were going to sort of touch her about how you're getting on with the manuscript, Michaela. But yes, the manuscript is in preparation, and we hope to submit it soon. Yeah.
Excellent.
So just to say about next steps, though, like it really encouraged me that the students were saying that the outreach is a big deal for them and whether or not they'll come in, because I'll tell you, sometimes we go to the school visits and the presentation is like talking to an audience of crickets. And it's because I realize I'm talking and I'm like, I'm not reaching out to you because we're not talking about something that you care about or is important to you. And so this is why we were thinking next steps is that if we can have Anne's group go in and be like, you tell me what's going on in your life right now, or what are the questions you want to ask me so that I can try to tailor my presentation so that we can have like a real honest, open discussion. That's what we're hoping to do.
Yvonne, do you still do the thing where they write questions? I don't know if they know how to write anymore. They write questions on paper and fold it up, and then you collect them and then you answer their questions?
Yes, so they do. And this is why you sometimes get a feel from school to school how it's so different of like what's going on. And it's surprising. So just to elaborate on what Marion's saying, when we go in the school visits, we usually give our presentation and then we give them slips of paper so they can ask us anonymous questions and we address them on the spot afterwards. And then sometimes you see that there's a theme. Sometimes they're saying that you could realize that they're telling you, I have a friend who's going through this. How do I help her? Or like, what should I do about this? Or someone I know is hurting themselves. What should I do? And you realize there's different concerns depending on who you're seeing. So we still do that. We're changing our presentation this year a little bit to try to tailor more to what the students are interested in. So based on the questions we've gotten in the past, we made a Jeopardy style presentation that answers their questions. That's how we're doing it this year. It's a Jeopardy.
I have a logistical question. Does the school board allow the Teenage Health Unit to publicize and put up a poster in the schools? Are you allowed?
We've never, so like, again, this goes back to the fact of advertising our services. Right now, we don't have anything. We don't have like a poster, but so again, to address the findings that we came from this project, we wanted to ask the medical students to design a poster for us to put in the schools with our website and our information so that we can advertise our services. But right now we don't have anything, but that definitely addresses one of the things that came up.
Anyway, again, fabulous work. please continue. It's important. And I guess with that, we'll close the session. Thank you, everybody, for being here. Thank you, Yvonne and Anne, for a wonderful presentation. And we look forward to hearing wonderful things in the future.
Thank you.
Thanks. Bye.
Thanks from coming so far.